Hi, I'm Meredith Marr at the University of Maryland Medical Center Midtown Campus. Today we're discussing ADHD with Dr. Adam Spanier, Medical Director at University of Maryland Pediatrics at Midtown. Thanks for joining us today.
I'm happy to be here, Meredith.
And thanks to all of you for watching. We invite you to leave your questions for Dr. Spanier in the comments section below, and he'll answer them during this live broadcast. Also, if you're tuning in, please be sure to like our video. Dr. Spanier, let's start off talking about what ADHD is.
ADHD is a term that stands for Attention Deficit Hyperactivity Disorder, and other people in the past used to also call ADD, which is Attention Deficit Disorder. So they've all come under the common term right now in most recent guidelines.
What's the difference between ADHD and ADD?
Well, so with ADHD, the newer term to cover all of them, there's three common behaviors that people might exhibit: inattentiveness, hyperactivity, and impulsivity. And depending on which combination, people used to classify them ADD or ADHD. And right now we usually just classify people as ADHD, and then the specific type of behavior that's exhibited, or combined type if you exhibit more than one.
Is it possible to be diagnosed with ADHD as an adult or just as a child?
Well, ADHD can be diagnosed as an adult. Just keep in mind I'm a pediatrician, but the behaviors are supposed to have been exhibited from an earlier age. So technically they should have exhibited those types of similar behaviors in early life.
And how does ADHD affect a child, whether it be in school or with their friends, their families, etc.?
Well, that's an important question that relates to the diagnosis of ADHD, because there are times when lots of people will exhibit inattentiveness, impulsivity, or hyperactivity that don't affect daily life. And when we have those sorts of behaviors that aren't affecting us, we actually don't have a disorder. We might just be inattentive because the talk is boring. But when you have those behaviors consistently and it's affecting your performance in school, for example, then it's a time at which we need to make an appropriate diagnosis and decide on an appropriate intervention.
How is ADHD diagnosed?
Well, it depends on the age. So ADHD is usually diagnosed by performing standardized assessments, usually a combination of questionnaires that are administered to the parent or guardian as well as teachers, because in order to be diagnosed with ADHD, you need to exhibit the behaviors in more than one setting, as well as have an effect on your schooling, or so your performance. So there's several different questionnaires that can be given. Most of the ones that we use are for older children. So for younger children, so when I use younger, I mean below 7, we go with other questionnaires that are more specific for that age group.
So it's possible that children may exhibit behaviors of ADHD at school, but perhaps not at home?
Well, so in order to be diagnosed with ADHD, you really have to exhibit the behaviors in both settings. So there are many children who maybe act out in certain classes that are completely fine in terms of their behaviors at home and in other classes, and that wouldn't meet the criteria for diagnosis with ADHD.
Throughout maturing in life, how does ADHD manifest differently from childhood to adulthood? How does it change the behaviors and how it affects your life?
Well, there are a couple important questions all wrapped up in this one. I think they're worth pointing out right now. Most of the time, according to guidelines, we don't really diagnose ADHD before age 4. It's very difficult because you're not really in more than one setting. Most of the time you're at home, or sometimes you're at preschool, but the setting's a little bit different than a school environment. And the diagnosis is really complicated in kids under that age. And frankly, many of the behaviors are normal for children that age. There aren't that many 2-year-olds that have a large attention span. So once you get to the school age, usually if you're diagnosed, you can, with your physician, and your school, work on a plan that that can help you develop appropriate adaptive behaviors and ways to address some of the behaviors you have so that you won't have the same effect on your performance, which once you do that, as you get older, you incorporate that into your everyday life, and it can make adulthood a little bit easier when you have ADHD too.
What can a parent do to support their child who has ADHD, or if they're feeling frustrated with some of their behaviors of the child, what can they do?
I think I would start back at the beginning to address that question and say, well, if you have a child who's exhibiting behaviors that you're concerned about, the first step is to talk to your physician about working to establish whether or not ADHD is a diagnosis, because there are a lot of different medical conditions that might cause behaviors that might look like ADHD, that if you address those conditions, the behaviors will improve. So for example, if your child has sleep issues and they're not sleeping well, they could be inattentive at school, and once you address some of the sleep issues, you might not have to worry about it. So the first thing is to establish the diagnosis correctly. Once you establish the diagnosis, you could come up with a plan for, depending on the age, whether you do behavioral therapy. Usually in schools, if a child has a medical diagnosis, you can work for a 504, which is a plan for a medical condition that the school sets up with the families to address whichever health or behavioral issues that are needed. And then once those are in place, I think usually parents have an easier time. But then again, incorporating some of those things into the home environment can be a little bit more complicated. So many of the behavioral therapy techniques can involve the parent in learning ways to adapt to the behaviors that might be more challenging.
How common is ADHD?
That's a hard question to answer for two reasons. One is I think that the diagnosis criteria have changed over time. So in the past, the frequency that we were seeing it might have been a little bit lower because we weren't diagnosing it in the same way. But depending on which literature you read, it could be anywhere from 6 to 12, 14% of kids. So it might be as many as 1 in 10.
And is this a condition that sticks with you for life? Is this something that you need ongoing treatment for as you age?
The short answer is yes. ADHD is not something you really outgrow. But the longer answer is that you don't always need to, if you do end up going the route of medication, you don't always need to be on medication forever, because what happens as a child gets older is they learn some behaviors to adapt to their environment a little bit better. So if their issue is hyperactivity, sometimes children can, they make, depending on their needs, it's really popular now, little fidgets that they can hold. So sometimes they can get some of their hyperactive impulsives out just by holding onto that, and that reduces some of their behavior, makes life easier for them. But then again, as you get older and you move into different environments, there are some environments that are more accommodating than, say, a school environment might be for somebody exhibiting those behaviors.
Great. So before we continue, just a quick reminder, we're here with Dr. Adam Spanier from University of Maryland Pediatrics at Midtown discussing ADHD. I'm going to do some quick introductions behind the camera. We have Hannah Braun assisting us with questions from the audience, and Angela Jackson, both from the University of Maryland Marketing and Communications Department. Hannah, do we have any questions?
Sure. Christina is wondering if she should keep her son off the medication he's been prescribed. Here's some background. He was diagnosed with ADHD. The medication, she says, puts him in a daze, so she stopped giving it to him on the weekends. He seems to be adjusting well, so she's wondering if she should just keep him off it. Her son's only 7, and she's worried that the medication may harm his brain.
Well, I think that we should probably mention that our conversation shouldn't be taken as medical advice, so that it's mostly educational. So speaking to an individual case is a little bit more challenging, but I can give some general advice that addresses that question. So in terms of medication and long-term brain development, the medications that we administer for ADHD usually don't have any effect on the developing brain. There are people who have been on it long-term, and we haven't seen any problems with that. There are some children who families choose to actually not use the medicine on the weekends. It all depends on the types of behaviors that the child exhibits, and oftentimes this is a good thing to discuss with your physician, whether or not you should do weekends off and summers off. A lot of times that's an option for children. And then the other thing to point out is that sometimes when a child is demonstrating, the types of potential side effects that are mentioned in that question, it might be the result of either being on the wrong medication or being on a dose that might be too high for them. So if I had a patient who were in that situation, I might discuss whether it would be worth trying a reduced dose or considering switching to a different medication. And again, it would all depend on ultimately how the behaviors are affecting the performance, because the big reason for doing this is to help children learn at school, because if your behavior is affecting your ability to learn, it's not going to benefit the child in the long term. And so we want to make sure that they're not getting in trouble, they're able to pay attention to their coursework, and then they're not doing anything impulsive that might put them at risk.
For parents who may be hesitant to go directly to medication for their child, are there any natural remedies or anything that could supplement the medication so they're maybe on a lower dose and they want to try some natural remedies as well?
Well, this is a question that I get asked a lot too, and actually depending on a child's age, medication is not the first choice for everyone. So for a child, say 6 and under, behavioral therapy would be a first choice. And then the choice of medication and initiation of medication involves a discussion. And frankly, for older kids too, bringing in behavioral therapy is a good option. In terms of the question related to natural supplements and alternative treatments, there aren't enough studies and there isn't enough data to say that specific vitamins or herbs or other supplements might have a beneficial effect on behaviors. We might advise that children avoid certain foods. So if someone's hyper, you certainly want to avoid caffeine. That'll make them even more jittery. So medication isn't the first choice for everybody. Behavioral therapy is a good choice for a family that is concerned about putting their child on a medication. And there are a lot of different classes of medication for families to consider, but we usually talk about a stimulant medication as the first choice because those have been studied the most and have shown the most benefit in the randomized trials that have been performed.
Great. Hannah, do we have any other questions from the audience?
Yeah, we had a lot of people wondering about if ADHD is hereditary.
I get asked that question a lot too. So the studies related to ADHD and genetics haven't identified a specific genetic marker that would predict if a child is going to have ADHD, but the studies that have evaluated risk factors for ADHD have demonstrated that ADHD does tend to be more common in families than randomly. So if a parent has ADHD, the likelihood of a child having ADHD is a little bit higher, but it doesn't necessarily predict that the child would have ADHD.
Great. Let's take another question.
Brenda is wondering if adults can develop ADHD.
So can they develop it later in life? Maybe they didn't have it, or you spoke to this a little bit earlier, that they may have exhibited some of the behaviors, but no one caught on when they were a child. Right?
Well, so I did allude a little bit to it earlier that adults can have ADHD, but the diagnostic criteria for establishing the diagnosis of ADHD usually require the behaviors to have been exhibited from an earlier age. And again, in the past, the way ADHD was diagnosed was a little bit different than it is now. So it's possible that some adults were not diagnosed earlier in life. And certainly we know that teens who have ADHD, who are becoming adults, continue to exhibit those behaviors. So it's certainly quite possible that an adult could have ADHD that just was not diagnosed as a child. But in terms of developing out of the blue, that's not something that would really meet the diagnostic criteria usually.
Is ADHD something that can affect anybody, or are there some people who are more predisposed to developing ADHD?
So that question is also another complicated one. The diagnosis of ADHD is a little bit more common in boys than girls, but the question that researchers have is that because we as a society tend to notice those behaviors more in boys than we do in girls, or potentially it might be that girls exhibit a different subtype of ADHD more than, they might be more inattentive and the boys might be more hyperactive. Mm-hmm. So there's still a lot of research going on to differentiate that. So my initial answer to your question might be, yes, boys might be more likely than girls, but that might be related to our diagnosis of it. The other thing is it does tend to sometimes run more in families. There are some medical conditions with which it might be associated more frequently, but again, it's just still an area where we're doing a lot more research.
Great. Hannah, do we have another question?
Yeah, we had touched on this a little bit. A lot of people were wondering about modifying your child's diet to help ease the symptoms of ADHD. What more can you expand on that?
So you mentioned not giving them caffeine. What else should they avoid, or maybe even add to their diet that could help calm them down or keep them on track?
Well, the studies related to dietary changes in ADHD haven't shown that there's a specific singular diet that might be the best choice. So I always recommend a well-balanced diet. If you feel like your child is lacking in a certain area, it doesn't hurt to give them a multivitamin, but I wouldn't go out and do mega vitamin dosing. I didn't quite touch on it earlier, but there are some studies evaluating environmental exposures in early life and behaviors later in life. So one of those is lead. So children who are exposed to lead in early life, so children who, not necessarily even lead poisoning, might be at higher risk of developing ADHD symptoms later in life. So in early life, you want to make sure your children are washing their hands before they're eating, leaving shoes at the door, and you want to avoid some of the other exposure sources where they might get into some of the lead hazards.
Great. Let's take one more question from the audience.
So Tracy actually commented asking specifically about what vitamins you recommend. Her son is on ADHD medication, so she's wondering if there's any best vitamins that you would prescribe.
So it's a difficult question just because so government regulations, medications tested and treated in a lot different way than vitamins and supplements are. So verifying the quality of vitamin and supplements is a lot more difficult. So I tend to recommend that if someone's going to look for a vitamin, they look for one that has a little marking on the label that says USP, which is a certifying agency that at least tests or determines that what the vitamin is saying, or the bottle is saying, is actually in there. Because again, the government in terms of vitamins doesn't check every single vitamin to make sure that everything that the label says is in there is actually in there. So I tend to avoid things that don't say have a USP mark on them. But in terms of going out and buying specific supplements to address the behaviors, I wouldn't necessarily recommend one versus the other. I wouldn't say vitamin A over vitamin E over this over that, but just because there isn't enough data out there in terms of the research. But a well-balanced diet, if your child is a picky eater and you're worried that they're not getting a well-balanced diet, giving them a multivitamin wouldn't hurt. I always say avoid too much iron because that'll cause stomach upset, and it's not necessarily going to help with some of the behaviors.
Are there any activities that you have found or that studies have shown are more therapeutic to those children with ADHD?
Well, so the problem with answering that question is that there's different subtypes of ADHD. So certainly if you have one of the more hyperactive subtype, you might benefit from being more involved in some sports activities, particularly ones where they get you moving. That way you can exert some of your energy during that sort of event performance. If you were more impulsive, you might have to make sure that you're not doing a sport that might put you at more risk in terms of your impulsivity. So you might not want to, do ski jumps or something like that.
Great. Let's take another question from the audience.
Julie's 12-year-old son is on ADHD medication. She's wondering if she should expect any changes when he hits puberty.
Puberty, your hormones change, you can see some behavior changes. Usually people don't outgrow ADHD. It might worsen with some of the mood swings, but I wouldn't necessarily expect that he will either outgrow it or he or she, whoever is out there, will outgrow ADHD. But I would expect that going through puberty might be a little bit more volatile. They might need to adjust the medication if their child is on medication. Actually, a lot of the medication is based on weight. So anytime there's weight changes, we might have to talk about whether or not you have to go up a little bit on the dosing, because you might see some of the behaviors return as the medication might not be as effective with a lower dose for the amount of weight the child is.
Is there ever a possibility that ADHD will change for a person? So maybe they were impulsive to begin with, but now their hyperactivity has seemed to increase. And do you reevaluate ADHD ever? Is this like something you would do yearly, or?
Well, so I think it's probably important to. So when we talked about the diagnosis of ADHD, I basically talked about some of the questionnaires that we administer. I didn't talk about what the guidelines relate to therapy. So once we initiate therapy, we don't just say, let's start this medicine and you're done. We usually will start a medication and look for side effects during the first week or two. And if we're noticing side effects, we might need to talk about switching medications. But usually by the end of that first month, most physicians will have a follow-up visit to discuss the behaviors, whether or not the dosing is accurate enough to address the behavioral issues that they're having that are affecting their performance. And once it might require actually frequent visits in the first few months to get to the right medication and the right dose, because each child will have a different medication that might work best for them. And each person might slowly need to escalate to the right dose, because most people won't start you out on a really high dose. They'll start you on a lower dose and work their way up. Once you get to a stable dose, usually you'll meet with your physician every 3 months to talk about how you're doing in school and how you're doing at home. So a lot of the focus is on performance, and there are special questionnaires for follow-up of performance that help us evaluate whether or not our therapeutic plan is addressing all the issues that we were working to address with the families. So in terms of switching between types, most of the time there are a lot of people who have the combined type. So it's quite possible that when you're originally diagnosed, if you met the criteria for hyperactive type, you might also have some inattentive qualities or some impulsive qualities. And if we didn't initially say, well, you were hyperactive and impulsive, we could have missed it earlier in some of the questionnaires. So that might account for some of the switching people might see. But we know that many of these behaviors can go together. So I wouldn't be surprised if someone went from hyperactive to impulsive, or a little bit of both. I would find it a little, well, I think we see a little bit of everything in medicine, to be honest. But I wouldn't necessarily expect that people would evolve from one to another.
So for those of our viewers who are watching right now and they have concerns or questions, is the first step to see their child's pediatrician and to discuss their concerns with them?
I think that's a good first step. The other thing that they could do is they could talk to their child's teacher. Now, if the reason they're talking to the pediatrician is they've already talked to the teacher, or they've already gotten a phone call from the teacher saying, your child's behavior in class is affecting their performance, I really think they need to see their pediatrician, then definitely start with a pediatrician, where the physician can get a thorough history, do a physical exam, and talk about next steps in terms of evaluation. Again, I mentioned that there are some medical conditions that can cause some of the behaviors that we see with ADHD, that if you address those conditions, you might actually clear up the issue and demonstrate that the child doesn't have ADHD. Some of our questionnaires kind of get at whether or not there's some comorbidities, which means that whether there's other problems going along with ADHD. So we mentioned teenagers before. Some teenagers have depression. Having depression can cause inattentiveness. Not sleeping well can cause hyperactivity, believe it or not. It can also cause some behaviors of inattentiveness. So there's some medical situations that if we address the medical situation, sometimes we don't end up with a diagnosis, but definitely start with your pediatrician or family medicine doctor, whoever provides primary care, as the initial step for the evaluation.
Great. That's all the time we have today. If you still have questions for Dr. Spanier, please be sure to leave them in the comments section below, and we'll reply within 48 hours. Thanks for watching.